Hi there. Have you gotten pregnant and then miscarried and then gotten pregnant again and miscarried in a row? Maybe even more than once? If that's the case, we're going to talk about recurrent miscarriages today and some things that you can, you know, check out about yourself. And then at the end, I'm going to let you know some options that you can do as well to help you make sure that you can sustain the whole pregnancy so you can have the baby, right? It's not always just about getting pregnant, as you, if you have experienced that, know more than anybody. I'm Denise Noyer-Erez, and I'm known as the Fertility Godmother. And today we're going to talk about this challenging time when you get pregnant and then you lose the baby. And it can be anywhere between 6 weeks to 12 weeks. Sometimes it's even late trimester, in the second or third trimester when that happens. And there's a lot of unknowns, and there's a lot of horrible feelings that go with that. Losing a baby once, and then if you lose a baby more than once, it's really mind-boggling. So I'm going to share with you some things of some reasons that are common, or not even common, that's not the right word, but that can happen, that can cause a miscarriage, that I'd like you to advocate for yourself. I've found that women, I work with a lot of women who, this one is recurrent miscarriage is near and dear to my heart. And I work with a lot of women who have had several miscarriages. And it turns out that most of them have to be their own advocate. Sorry for this important discussion, and I don't know if you hear my puppy. That's one way to help you feel better, get a little puppy or a little kitty cat. He decided to wake up right now. Sorry about that. Anyways, so I've actually have to talk to women to be their own advocate for when they go to the doctor, because the doctors, some doctors, of course not all doctors, will give a, they don't go through, they don't maybe know what to do, or maybe they're with an HMO and you have to advocate for your test. But there's things that you can do that you need to find out to make sure that you can correct what's going on. So there's certain things like, genetics can be a big deal. So if you do have a miscarriage, you definitely, if possible, oh my goodness, that's really distracting. Hold on, guys. I'm sorry. So, sorry, last week we got to see my little puppy for the first time after his wellness visit. And here he is growing big already. He should make you happy. So fur babies are also fun to add to the family. Anyways, so there's some things that are really important for you to know. Obviously, there's genetic problems that can occur when you're trying to get pregnant. So if possible, you want to have the baby tested, or the fetus tested, or the embryo, whatever it is at the time you lose it, if that's possible, to get some of that that tissue material, because that'll give you some really great information. If it comes back abnormal, okay, then you try again and there's nothing else going on. But what happens when it comes back normal? Now, there's a couple things that can happen. It could, if it was a girl and you found out that it was a girl, it could have gotten your tissue. But if it came back normal, then you want to start looking at other things, such as maybe there's an immune issue going on, or maybe there's something anatomical in your uterus that caused it. Maybe there's something going on with your thyroid or your immune system. Sometimes weight, having your blood sugar levels going crazy can cause a miscarriage. So you want to take a look at everything possible so that you can ensure the best you can to make sure that you end up taking that baby home so you can cuddle with it. And so it's really, those are some things that you could do. So there's some testing done. There's blood tests that you can have done. And that would be you testing for like a thrombophilia panel or lupus or anti-nuclear antibodies, anti-phospholipids. Those are going to be some of the things that you're going to have to really advocate for. A lot of times insurance companies, they don't want to pay for these tests unless you've had 2 or more. I think it used to be 3. I think that most of the companies lowered it to 2, which is, I'm so happy, because if you've had 2 consecutive miscarriages, you want to be able to get tested. So you want to test for with like a thrombophilia panel. So other things that can happen are, the sperm quality. If you're miscarrying early, then the sperm quality can also impact that. So that's why if you follow me, you realize that I really enforce both partners, both of you guys, to be as healthy as possible when you're trying to conceive. And then after you have your baby, I still advocate a healthy lifestyle because I want you to live a full, vivacious life. But it's really important to be as healthy as possible, both partners. And there's things that both of you can do to do that. Make sure that is. So lifestyle is a big deal. Genetics, is really helpful. You can get a genetic screening if you can test. I just put him down. I hope he doesn't bark again. If you get a genetic screening on both of you to make sure that there aren't any diseases, and once you've ruled all that out, then it comes to, well, we really don't know. But I've even seen women who have had inseminations and they've implanted and then they miscarry. And then later on they do a saline ultrasound and they realize that there was a small fibroid or a polyp that occurred. So if you're even going down the route of having an insemination, then sometimes the doctors they usually check if you're going to do IVF, but they don't always check if you're going to do an insemination. So you want to make sure you can roll it out, because that's just a quick little procedure they can take care of right away. And it's, they can go in laparoscopically or figure that out really quickly. And you want to make sure that you're with a skilled doctor who does that. Then you're concerned about scar tissue. That could be another complication. But most doctors, you go to a good doctor who can perform this procedure. It should help you pretty quickly. You'll heal, and then you can, feel confident that you can have that baby. So the other thing is the blood test. So what do they do when you have these blood tests come back? So there's different things, they're still unsure, but they treat things prophylactically and you end up being able to take home a baby. So that's the one way to go about doing this. Oh my goodness, I'm like home, I'm back on schedule, super excited to be with you guys. I got the puppy, I got the phone. This is crazy, talking about some really emotional stuff here. Sorry. Oh my goodness. I guess that's what happens when you go live, right? Things that are unpredictable. Set everything up and here we are. Okay. Thanks for listening. Anyways, so some things that you can do besides medicine, and I work with a lot of doctors. We work in combination with treating this. But what I do is I help get your body strong and to prepare so that it can thanks for laughing, guys. I appreciate your sense of humor. Get your body strong so that it can hold the baby. So we look at things, I look at things a little bit differently from a holistic point of view than do you want to so we're going to strengthen the body, strengthen the immune system, help make sure there's good quality blood flow going to the placenta to nourish the baby. We do these things like this, and we use acupuncture and Chinese herbs. And we make sure that you and your partner are as healthy as possible so that you can get there. And it works really well. It's something that's near and dear to my heart because there's not that many options at this stage, and it's so heartbreaking, and I really get that. So if this is something you would like to reach out and talk to me about and see if that's an option for you, please feel free to either call or comment in the comment section below. Just let me know if you want to consult. We'll reach out for you. Just write in the comment section, free consult, or call our office, send us an email, and I'd be happy to get on the phone and just kind of talk to you and see if I think I can help you. I know I'm working with a woman right now who doesn't live in the state, who's had 3 miscarriages, and I had to help her advocate for her doctor, or advocate for herself to get these tests done so that she can at least rule some things out, and then we know what the next steps are to take. And then I recommend I put her on some Chinese herbs. But I work with women like yourself who can get pregnant but have a hard time keeping the baby. And we just want to make sure that everything is covered so that you can have your baby. So please give me a heart if you found this valuable. I appreciate your time today. I'm sorry for all the craziness. If I can help you, reach out to me. I would love to help you. I'd be honored to help you. I just want to do a little quick recap. So you want to make sure that you had a pelvic exam and that you had a saline ultrasound so that you can be sure to just make sure that the uterine cavity is clean, even if you've had kids before. And then you want to make sure you get a blood test done. Ask for a thrombophilia panel or the recurrent pregnancy loss. There's actually a recurrent pregnancy loss panel. And the doctor should know that. If not, I can help you. But they're going to be looking at your immune system. You want to make sure your thyroid was in healthy range, not the normal range for a thyroid, but the normal range for pregnancy, which is usually around 2. I've seen some doctors let it go at 2.5. But usually a lot of the doctors I work with like it around 2 and under. So you want to make sure that that's normal. Obviously, if you can do any genetic testing, that would be really helpful. Sometimes, what else? Oh, the glucose, the sugar. So that's something you can really take care of your diet by eating really clean and healthy and eliminating sugar. Some women who have PCOS or diabetes can struggle more, so you have to put more effort in to be healthier, to balance your sugars, or take something to help you with that. All right, so again, please go ahead and comment in the comment section if there's anything I can help you with, or just reach out to us, give us a call, email. I'm always here for you. Make it a great day, and I know that you can have your baby. And I know sometimes it's not just your first time. Sometimes you have kids, which just seems more mind-boggling. And then all of a sudden, you're miscarrying. I've seen it so many times where women have had 2 kids and they're wanting a 3rd kid, either with the same partner or they remarried. And then all of a sudden they're miscarrying. And it doesn't make sense because you've had 2 kids. But there are things that happen later on. Something gets turned on. So feel hopeful. I know you can have a healthy baby, and I'm here for you if I can help you. See you next week. Here's to your fertility.